and welcome back to the video. I'm your host, Kara Love, right here on Your Comments Matter. Hey, listen, we are continuing the story about the healthcare system, and today's video is coming from New Jersey Spotlight News. This video is titled "Bracing for Medicaid in New Jersey." So we can see that this is having an effect in all of the states. So we've seen Texas, we've seen Washington, and now we're going to see New Jersey. So this video got over 12,000 views. So you know there were some comments in there, and we were able to bring out some of those comments for you here on today. So the commenters today that's going to be featured are Chris Phillips, Brenda's, Rockstar, and Brenda's again. I think I did a duplicate there. Sorry about that. But so these are the commenters here on today. So let's get into the video and we're going to see what they had to say about bracing for Medicaid cuts right there in the state of New Jersey.
President Donald Trump signed into law his massive tax cut and spending bill on the July 4th holiday, just one day after the House narrowly passed the controversial measure and sent it to his desk. This so-called One Big Beautiful Bill makes permanent Trump's 2017 tax cuts and expands funding for immigration enforcement and border security. It's a big win for the president and his allies, who celebrated at a ceremony outside the White House on Friday. But the bill has been widely criticized for paying for those priorities by cutting funding for food assistance and health care, with new requirements that are expected to push millions of Americans off Medicaid. Here in New Jersey, hundreds of thousands are expected to lose coverage over the next decade, including individuals with disabilities. Senior correspondent Brenda Flanagan reports.
When the president signed what he called the most popular bill ever on July 4th, he highlighted its sweeping tax cuts paid for by deep reductions in spending aimed primarily at social safety nets like Medicaid.
The largest spending cut, $1.7 trillion, and yet you won't even notice it. Just waste, fraud, and abuse.
We're talking about kicking 350,000 eligible residents off of New Jersey Family Care is not about addressing fraud or waste or abuse. This really undergirds our public health system in New Jersey. Everyone will be affected by that.
State officials warn New Jersey's public health and hospital systems face a $3.3 billion annual cut in federal funding that will slash services. But Republicans like Congressman Jeff Van Drew, who voted for the bill, argue there will be no loss of Medicaid for legal eligible recipients. There will be no changes in coverage for those in need of assistance, including kids, expectant moms, seniors, or people with disabilities.
For us, having this Medicaid has been a lifeline.
This Newark mom needs Medicaid services to care for her
She
disabled son at home while she's at work.
There is no way we'd be able to hold it together if Manny didn't have that private duty nursing and the services and the respite that come with Medicaid.
But she says the new law now mandates a 20-hour work week for able-bodied adults on Medicaid. And it also makes some re-register for benefits every 6 months instead of once a year.
Ooh, I didn't do that.
Her family mistakenly lost coverage for 2 months because she says the bureaucracy is already overwhelmed by paperwork and riddled with errors. She fears thousands will.
She must have been nervous for 2 months.
It's still such a complicated.
They must have been a nervous wreck.
This can mean devastation for so many families that are already exhausted. They are working hard to the bone, and the last thing they need is discouragement in a life that's already hard.
That's exactly what the bill is designed to do, is to create bureaucratic barriers to keep otherwise eligible residents off.
That's why they got to renew every 6
Republicans
months.
regard Medicaid as a flawed and bloated system that needs radical reform. They welcome the new law.
Ooh, they say radical.
Newsmax, Congressman Steve Scalise noted,
those able-bodied adults who are turning down work, the 35-year-old who's sitting at his mom's basement playing video games, is going to have to go get a job again.
All right now, you better say it.
Stark.
So it's disheartening. It's it's a grim time.
Gwen Orlowski advocates for New Jerseyans with disabilities. She says a recent meeting of stakeholders figured the funding cuts could end up reducing options like dental services or home and community-based programs like visiting nurses.
So all of those things, I think, are on the table to come into play as the state is going to have to figure out how they're going to run the Medicaid system with so many fewer federal dollars.
All right, everyone. Hey, listen, we're going to stop it right there. You saw it. You saw the signature. You saw Trump signing that big, beautiful bill, and you're hearing the stories from these actual people that are going to have to live through the effects of this signage of this into law with the changes in Medicaid. Wow. Did you hear? Trump said they're going to cut $1.7 trillion in cuts. That tells me that that's a whole lot of fraud going on. Because if you're cutting those that's illegal, you mean they doing that much? You mean the illegals are doing $1.7 trillion? How long have they been doing it? Why didn't previous administrations, why didn't administrations before and before and before and before and before catch this problem? If this is all illegal people that are taking advantage of the system, y'all, that's a whole lot of money. That's a whole lot of money. You had that up year after year after year. What? So we're gonna see. But this, did y'all see that one mother? She looked like, she was describing it. She's a citizen. Her family is a citizen. She lost coverage for 2 months for her disabled child. So this thing is having a wide effect on legals and illegals. Okay. Wow, that is something. So there you have it right there. But let's get into some of the comments. And you may have a comment that you want to express right here, because why? Your comment matters. Let's take a look at our commenters today. Our first commenter is coming from Chris Phillips. I'm sorry, Chris Phillips. Chris says, people with disabilities will not lose their Medicaid benefits. Able-bodied adults are only required to work 20 hours a week to keep their benefits. I support Medicaid, and we must make sure that those that need it will have an access to it. Great comment, Chris. Chris got 36 likes on that comment. What about you, audience? Do you agree with Chris Phillips' comment that yes, the people with disabilities, they won't lose their benefits, but that one lady showed that she did. She said she lost it for 2 months. Why did that happen? You see, so they will lose it. So we got this. There's a whole lot of stories going to be coming out on who's losing what and who's keeping what. We're going to hear from the people. But again, Chris, we understand. We see your point of view there, and we thank you for your comment. Let's take a look at Brenda. Brenda says, anyone without insurance is a threat to America. Everyone needs to have proper health care. Ooh, now that's a comment that matters. She got 7 likes on that when this aired. But I tell you, Brenda, that's a great comment, because like you say, if we don't have insurance and we get sick and everything, we're gonna have to go to the hospital. You don't go to the grocery store when you get sick. You ain't going to the bank when you get sick. You're not expecting your banker to help you out. You're not expecting your grocer to help you out. You go to a hospital. So you better have a system set in place to take care of these people. You better do something. What's your plan? We don't want no concept. We want a plan. What you gonna do? What are you doing? There it is right there. It is a threat to America. She's absolutely right. You don't think these things are going to affect you? Oh, it will. Yes, it will. When it's your grandmother, your mother, your father, your brother, your sister, your daughter, your son, your child, your niece, your nephew, when it's somebody related to you, your best friend, your co-worker, whoever that person may be, kid, you may get a phone call. They're not here no more. They died last night. Didn't have no health care. Can't afford it. They want the system did kick them out. Said, no, can't come here. You ain't got no health care now. We can't do nothing for you. What? You'll wake up then, won't you? Ooh, this is something. Your comments matters, everyone. Take a look at Rockstar. Rockstar has a comment and it says, I just don't understand why a fully healthy adult is upset that they have to work to earn benefits. It's kudo fraud and abuse. And these new footages really tell how many people do not want to get a job. See, if you got a disabled child and you're an able-bodied working mother or father, somebody needs to stay with that child. You can't expect that one parent to go out and work and leave the child, with even more costly expenses when the mother could be there for her child. So yeah, she may be able-bodied to work, but you can't expect her to go out and work 20 hours and come home and take care of a disabled child. That ain't gonna work. She needs to be there full time with that child. So you shouldn't expect her to get a job. Now, the other person, if there's two people in the household, yeah, the other person can go to work. Yeah, you able-bodied, go to work. You can go to work too. Yeah, if you able-bodied. See? That's how it should be. Again, these are your comments and they what matters. Take a look at our last one. We got Brenda again. That's why we had Brenda twice on, because she came back and had something else to say, huh? Sometimes we make comments out there on social media and be like, oh man, I should have said this. And well, I can go back and make another comment. So Brenda, what do you have to say again? Brenda says, just remember, you reap what you sow. That's right, Brenda. Like Brenda said earlier, she said, anyone without insurance is a threat to America. Everyone needs to have proper health care. So again, you reap what you sow. If you're sowing no health care, you're going to reap it and people going to die. If you're sowing good health care, then you'll reap healthy people. See? You reap what you sow. All right then, everyone. Hey, listen, that's going to do it for us right here at Your Comments Matters. Hey, you better watch every week because you just never know. You might just be on Your Comments Matters. I'm out there and I'm watching different things on different subjects that pertain to us as senior citizens that you may need to know about and how others may feel like you do. All right. Okay, everyone. Thank you so much again. Hey, listen, as always, I want to say what? See you on the next video. Thank you so much for watching, liking, sharing, commenting, and subscribing to Your Comments Matter. See you on the next video.